Hi, I am Dr. Vikasdeep Bansal at Adesh Medical College, Bathinda. Our Department of Critical Care Medicine is the first ever separately formed department in any hospital of the surrounding regions. The reason for forming this department separately was because ICU care or critical care medicine is a different ballgame altogether. Plus, it's a young specialty, around 25 to 30 years old in India. Due to that, there's a lot of dearth and shortage of properly trained intensivists in this field. It is a recognized specialty by the NMC since 2012. As a department of critical care medicine, we receive sick, moribund patients literally sitting at the jaws of the death with impending organ failure or when the organ failure has already settled in. At this juncture, we work both independently and sometimes in collaboration with the concerned specialty like intervention radiologist, neurologist for acute ischemic stroke, which is called code white, or code blue, where we resuscitate a patient and involve the concerned specialty like cardiology in case of heart attack, or sepsis, where time is the most important in administering antibiotics, and we work according to survival sepsis campaign guidelines. In all the cases, or in need be, we work according to the set international protocols and guidelines depending upon case-to-case basis. We have a proper system of admitting patients from the emergency to the ICU whosoever requires ICU admission. In the ICU, a proper careful plan is formulated for a patient depending upon his history, clinical examination, supported by the labs, bedside investigations, or any bedside interventions like CRRT, echo, or ultrasound. All the care and the stress is laid upon the rapid and the early exit of the patients from the ICU so that patient can be with the family as soon as possible, which will help him both mentally and financially. We also have a unique concept of OPDs in the Department of Critical Care Medicine by the name CCFC, expanded as Critical Care Follow-up Clinics, where we see the patients who are discharged from the ICU from critical care point of view and from general medicine point of view, which is also open to general public for the general ailments. Last but not the least, having said so much about the critical care medicine, sometimes, unfortunately, patients do land up in some unfortunate situations where we are unable to wean off the patient from the organ life support systems. At this point, we have an open-end discussion both with the primary consultant and with the family so that a shared decision can be made wherein relatives can choose between quality and quantity of life so that the patient does not suffer. At this point of time, we also intend to give end of life care or EOLC and also palliative care to all those required.